But today we're having a discussion on the learning outcomes of the health and social care. Our main learning outcome will be to outline the points at which health and social care provision may be required during a lifetime. And we also have to look to describe the health and social care services required and provided at different points during a lifetime. And then 2.3, explain arrangements for long-term care provision. And 2.4, explain how services are assessed at each provisions and all that. So these are the things that we'll look at. We'll talk about the assessment criteria when I've finished lectures today. Joel, didn't you do the learning outcome to the last time?
Sorry?
Did you not discuss about this same thing last week? Didn't we? Or
Yeah, sir. In the last class, you taught about this.
so I don't know why we have a discussion on the same thing again. Because I think we discussed learning outcome 2, didn't we? So we should be doing 3 today, isn't it?
Yes, sir. Yeah.
Okay, hold on 1 minute, please. 1 minute. 1 minute. All right. In any case, I'm just trying to clarify because I don't know why we still have this. No? Yeah. Today's lectures is learning outcome 2, but it looks like last week I did that lectures. So can you check for me because it's not supposed to be 3 right now, but for the level 3 class. Because it's the same. Yeah, check and get back to me. I'm on the group now. Just give me a second. Just a second. Hello. What course are you? Level 3 of social care. Level 3. Level 3 of unit. Yeah. Hi, Selena. It's Gio. Oh, sorry, Gio. Yeah, Gio. My Zoom it says learning outcome 2 for today's lecture. It's LO3 today. Yeah. The level 3 social care. Yeah, LO3, but the Zoom that was sent shows LO2. So okay, that's fine. Let me. It's fine. Let me. Yeah. Okay, the Zoom shows LO2, so that's fine. It's fine. Okay, bye. Yeah, so hi guys. Hi guys, can you see me? So we are rather having LO3, and we're supposed to understand the different areas of specializing and within health and social care. And 3.1, we need to analyze the different specialist areas within health and social care. 3.2, describe a range of health and social care professions. So these are the three things that we are going to look into today. Bear with me, let me LO3. So we have Adeyemi, Prashetai, and Jewel. Can you all hear me, please?
Yes, I can hear you.
I can only hear Jewel. The other ones, can you all hear me, please? Adeyemi? Hello? Hello? Class, can I know those who are in class, please, apart from Joel? Adeyemi, can you hear me? Anyway, let's proceed. So Joel, today we want to understand the different areas of the specializing within health and social care. What will be the different sectors within the health and social care that we have to consider? We need to look at the primary care, secondary care, and tertiary care. Where the primary care, we have to look at the NHS, the GPs, or the dentists as those who give the primary care. And then we have to look at the secondary care, which is more of the hospitals and the community care organizations. And then the last bit is more of the surgeries, the transplants. Those are more tertiary care. Those are more involving or intense treatment that is given to people. Sorry, I can't hear. Please, can you guys hear me?
Yes, sir, I can.
Your class people said they can't hear me, but you can hear me, isn't it?
Yes, I can hear you, no problem.
So please check your microphone. I'm having some people cannot hear me. Just one. So I don't know what is happening. A lot of people said they cannot hear me, but Joel can hear me, so I have to proceed. Then we have analyzed different specialty areas within health and social care. Different areas within health and social care. The specialized areas that specialized services support people with a range of rare and complex conditions. They often involve treatments provided to patients with rare cancers, genetic disorders, or complex medical or surgical conditions. They deliver cutting-edge care and are catalysts for innovation, support pioneering clinical practice in the NHS. We'll be looking at some specializing. You know the pediatrics, the geriatric, the maternity, mental and social work. We're looking into some of all these specialties within the health and social care, which is more geared towards the tertiary care of level 3 lectures. Now we need to have the pediatrics. What do? They are a bit of large and diverse specialty, which includes high technology specialists such as the neonatology and pediatric intensive care, as well as community-based specialists such as consultants are either hospital-based, general pediatricians, community-based pediatricians, or so places in the morning, in the following. We will have neurology and nephrology, neurology, respiratory medicine, pediatric intensive care, metabolism medicine, and all that. These are all specialties within the NHS or within the tertiary care function. Again, can you all hear me still? Can you hear me?
Yes, sir, I can hear you.
Yes, I can hear you now.
Aha. Adeyemi, where have you been?
I was not hearing you. I had to leave the meeting and rejoin again before the
Oh,
audio
is that the
could come
case?
up. Yes.
Because I've been asking Adeyemi, how are you? Adeyemi, where have
I
you been?
wasn't here. That's why I had to send a message earlier.
Okay. Okay. I think there's another person also who could not hear us. Is it Patrick? Can you hear us?
Maybe you send him a message to leave the
I have.
meeting and join
I
again.
have. I've sent. Let me
Yes.
send another message.
That's what I did.
Let me send another message.
Okay.
Can you end and rejoin? And rejoin. Rejoin. Join meeting. Please. Adeyemi, last week we couldn't see you.
Yes, sorry, I had to send a message, an email. I had
Okay.
a training almost at that time, but I don't know. Can I get a pre-record of what went on last week, please?
Mhm.
Is it possible?
What did you say? Say it again.
I said I was at a training almost at that same time, and I sent an email to the office. I don't know. Can I get a pre-record of
Yeah, you have
last
it.
week?
You
Okay,
can find it on your model. Every lectures you have pre-recorded. Don't worry at all. Okay.
okay. So how can I get it?
It should be on your model or the group. Look at the group,
Okay,
the WhatsApp group.
okay,
We normally share with them. Look at it.
okay,
Okay.
okay, okay,
All right.
okay.
All
Thank
right. So
you.
let's proceed. Joel can hear me. You can hear me. I think the last person should hear me as well. I've just asked him to rejoin, and that is what's his name? Um what's his name? Prashitan. Can you hear me now? Oh, what is happening today? All right, let's proceed because we have no much time on our side. So we have to analyze the different specialist areas within health and social care. Before you joined Adeyemi, I was talking about we have three functions within this learning outcome. We have the primary care, and we have the secondary care, and we have the tertiary care. The primary care, we are looking at our immediate setups around us, GPs, dentists, all those immediate um, service providers that we call on. Those are what we call our primary care, the community care. And then we have the secondary that involves a bit more community care, community nurses, and all that we call on. Then the last bit is the tertiary care that we're looking at those that involves a bit more intense treatment like surgeries, transplants, and all that. Do you understand? All right. So these are the three functions on that, but we need to look at some of the specialists. So in geriatricians, they work in variety of settings, A&E, medical assessment units, acute care, rehabilitation wards, care homes, and hospice. They provide patient-centered, compassionate, holistic approach and work with GPs. So these are some of the tertiary care people. These are specialists. They are consultants that may do either a transplant or maybe do physiology and all those things that these are all what we call tertiary care. The branch of medicine concerned with aspects of health and social illness in older adults. It is the largest medical specialty. So these are specialties that we need to know. What are the common procedures? Performing a comprehensive assessment of an older person, including a mode and cognition, gait, nutrition, fitness for surgery, including physical examinations where necessary. Assessing the patient's suitability for continuing care in NHS or the community. Assessing the outcome of rehabilitation. This is what geriatrics, this is what they do. And then let's look at the maternity, which we all know. Maternity support worker is the front line of a family journey through a pregnancy, childbirth, and first few days We all know what maternity support workers do or nurses do. They provide care for mothers and babies. They make routine observations either before or after. They update records and other admin tasks. They take blood samples, as we all know. They prepare equipment and promote breastfeeding. They report problems to register midwife or nurse. So these are all key functions of maternity support workers or maternity nurses, either before or after. Before a person gets pregnant, there will be checks, there will be pre-antenatal, meetings here and there. So these are the duties. They work with the community, they do maternity theater, they deliver suits, they work midwifery-led units. So these support workers, which you can specialize, they work with the community, they can work with the maternity theaters, even within midwifery-led units or community-based maternity units as well. Then we have to look at the mental health support workers. They work with, these are mental health, describe the huge impact that great mental health care had on their recovery and lives. You may have different roles within that sector. You may have psychiatrists, occupational therapists, pharmacists, nursing associates, prison nurse, mental health nursing, mental support worker, drama therapists, psychologists, name them. And mental health nursing offers a high quality, meaningful clinical experience from nursing associates to registered nurses, those in advanced practice. Mental health nurses have a wide range of skills that are vitally important to the running of mental health services. So these are all areas and functions within mental health that support workers function in, or support work nurses function in. So these are all key areas. Then we have social care workers. Social care workers. They work with families and others, and in different areas. They work with families and others around them with different client groups, including, I hope you guys can hear me.
Yes, I can hear you.
Okay.
I can also hear you.
Feel free, if there's any breakages in communication or you can't hear me, please draw my attention, please, because sometimes I think the internet may have these issues here and there. So feel free. Any questions at all you can ask. Social workers make difference. Just one minute. Let me adjust this. We are adjusting that. And social workers, that's what they do. And we, in the elderly, children with disability, teenage, mental health problems, young offenders, they all need mental health nurses to help, even refugee asylum seekers. So social workers can also specialize in visiting clients whenever they are, assessing clients' needs, organizing support, making referrals to other services and agencies, keeping detailed records, and attending meetings. These are all functions of mental health support workers. Any question at all? Any question, Joel, at this stage?
No question.
Joel, any question at all?
No, sir. It's okay for me.
Okay, so let's look at professions within the health and social care. We've spoken about the types of care delivery within it, but let's look at the professions or the personalities that we can find within the health and social care. We all know there will be doctors that work within the healthcare sector. There are nurses, there are specialists that I've just mentioned, whether neurologists, whether psychologists, name them. There's a healthcare worker, which is one of you who are doing the level 3 healthcare worker. They play major roles when it comes to the health and social care. Social workers that work with the social service, and then social care worker. So we have a social worker and a social care worker. The social worker is more higher. We call it the work with the social, and the social care worker is like a support worker. So these are profession within the health and social care. But what roles do they play? What roles do doctors play? We would categorize, or we would assign doctors under primary care. I didn't mention that they are primary care, secondary care, and tertiary care. So we would assign doctors under primary care. And what do they do? We all know what doctors do. I don't want to go much into it. Doctors give medicine, they maintain knowledge, they treat patients with they work partner. We all know what they do. They don't have to discriminate unfairly against patients or colleagues. Never abuse your patients, trust you or public trust in them. They take prompt action if they think patient safety, dignity, or comfort is being compromised. These are all rules of doctors. What about nurses? Nursing is a profession within the health industry focused on the care of individuals, families, communities, so that they may attain, maintain, or recover optimal health and quality of life. These are all functions of nurses. What they record medical history, as we all know, and symptoms. They collaborate with teams to plan for patients' care. They advocate for health and well-being of patients. They monitor patients' health and record science. They administer medications and treatments. When it comes to operation, they perform diagnostic tests, don't they? They do that. They educate patients about management of illness. That is true. They provide support and advice to patients. That's what they do. Is there anything that you know about nurses that is not captured here?
No.
Okay. Let's look at the specialists. And I say specialists they all fall under tertiary care. Doctors, nurses are under primary care. But specialists fall under tertiary care because specialists, they are like consultants or physicians who more like doctors but advanced in what they do. So this involve chemotherapy, radiotherapy, kidney displays. These are doctors that deal with it. It includes range of treatment from intervention that most of us have heard of. It even includes transplants, surgeries, all these surgeries, stomach surgery, bottle surgery, all that, they all fall under tertiary care. Specialized services are not available in every local hospital because they have to be delivered by specialized teams of doctors, nurses, or other health professions who have the necessary skills and experience. Unlike most healthcare, which is planned and arranged locally, specialized services are planned nationally and regionally by NHS England. That is true. So they have to be properly coordinated and arranged by NHS England at various hospitals and sectors. And that is why sometimes, if you don't realize in the UK, you have to be booked to meet a specialist, maybe an optician, or to meet certain surgery, or those who deal with pediatrics and all that, because they are not assigned per an hospital per se. They work around. What about the healthcare? The role of an healthcare. What do? They help patients to move around. They monitor patients and perform basic health checks. That is true. They make patients feel comfortable. That is true. That's the work of a support worker. They wash and dress patients, personal care. That is true. They serve meal and help to feed patients. That is true. So they help as companionship as well. They are there to help with the day-to-day activities of the patients. That is true. Do you have any questions at this stage? Okay. A social worker is let's get to social workers. What do you say? Who is a social worker is a profession in which trained professionals are devoted to helping vulnerable people and communities work through challenges they face in everyday life. So, what is the role of social workers? They promote 1 minute. Hello, sorry, you guys. Looks like there's some issues happening. 1 minute. Just bear with me 1 minute, please. Guys, I'm coming. 1 minute, please. Okay. There's something happening. Just 1 minute. So we have to also look at the support workers and social workers, what they do. They promote social welfare. They advocate for social economic justice for members of diverse communities. They embody social work code of ethics. How many know who is a social worker? Do you know what they do? I don't mean.
Okay, social worker. Well, from the little I've known over time, they actually help people that are less privileged, children, elderly, or vulnerable people in the society.
Mm-hmm.
Yeah, that's the little I have known before now.
Okay, so you say it again.
They help vulnerable people in the society, children, elderly, mentally disabled people, in order to give them a proper life or to make them more comfortable.
Mm-hmm.
Yes. And to stand and fight for their rights too.
Mm-hmm. I did me 1 minute.
Okay.
Let me hold on. I did me.
Yes, sir. I'm with you.
Your answer wasn't too clear. You said, what do you know about them, please?
Okay, social worker, their their responsibility in the society is to take care of vulnerable people, fight for their right and justice, and their social well-being, mentally and socially.
Okay, I think that's a good answer. Joel, what's your take?
Yes, social worker means it's a profession training profession and developer to help the ordinary people to face their new challenges in their daily life.
Say it again, Joel.
Social worker means. Hello.
Yeah, I can hear you.
Yes, social worker means to help out ordinary peoples and face their new challenges in their daily life.
Okay. Well, it is true. So what they seek to do is to ensure that people are protected against abuse. Okay, it's against
Okay.
abuse.
Yes, sir.
Against abuse and all that. against every form of issues that people go to. They protect adults and children against abuse, and they work with the social services as well. That's what they do. So social workers, if you look at it, help clients needs situations, help clients adjust to changes and challenges in their lives, such as illness, divorce, or unemployment, respond to crisis situations, advocate for help, and clients get resources that will improve their well-being, provide individual, group, and family couples, provide individual, group, and family couples for therapy, provide individual, group, and family access clients' histories and background, develop treatment plan with the client's doctors and other healthcare professions. That is what health support workers, that's what they do. Then we have to look into let me go down. Apply access to professions and regulated. Let's look at regulation. What do you understand by the word regulation? Adeyemi.
Okay, regulations are measures put in place to checkmate excesses in our environment or working environment.
Adeyemi, I didn't hear you.
Okay, I see regulations are measures put in place in order to curtail excesses in our working environment, or it can be of safety measures too in our working environment.
Okay, that's fine. Joe, what's your take?
Yes, they play a major role in healthcare and insurance coverage. Yeah.
Okay, so regulation play major role in health care industry and health and social care insurance coverage. The various regulatory bodies protect public from a number of health risks and provide numerous programs for public health and welfare. Together, these regulatory agencies protect and regulate public health at every level. Which organization inspects and regulates the health and social care? What's happening? 1 minute. So regulatory agencies protect and regulate health at every level. So all they seek to do is to protect the public from a number of health risks and provide numerous programs for public care and the welfare. They all seek the welfare of the. What organizations inspect and regulate the health and social care industry? What organizations do Then we first of all we have the CQC. How many know about the CQC?
Oh, I've heard about it, but I've not read much
So,
about them.
okay, so basically CQC, what they do is they regulate in terms of registration, inspect care homes or healthcare facilities. Responsible for registration, regulation, inspection, and rating of all providers. So the CQC regulates healthcare organizations, even care homes or even hospitals. Health and Social Care Regulator for England responds for registration, regulation, inspection, and rating of health providers. So all they seek to do is to make sure that companies or healthcare providers comply with regulation, the same regulations we are talking about, health regulations. That's what they seek to do. So CQC have the right to ban or to put an end to a healthcare providing company if they feel that you cannot. 1 minute. Let me adjust this. Online access to professions regulated, and then we also have, and that's three. That's what CQC does. Then there are 13 other healthcare regulators, including ACP. The ACPC is Health and Care Professions Council. So they regulate professions like ODP, Operation Department of Practitioners, orthopedics, paramedics, physiologists, social care in England, and speech language therapists. These are all professions that the arts therapists, biomedical scientists. These are all professions that the ACPC regulates. Sorry, the ACPC regulates. So if you are about paramedics, you don't fall under CQC, you fall under ACPC. But the CQC is more general. The CQC regulates every care home healthcare providers. They don't regulate human beings. They don't regulate professions. They only regulate the provider, the provisions, or the company that provides. You understand? Yeah. So health regulators, we have the General Chiropractic Council, GCC. We have the General Dental Council, GDC. They regulate dentists. We have the Nursing and Midwifery Council. We all know that. It regulates nurses and midwives. We have the General Optical Council. We have the Pharmaceutical Society of Northern Ireland. They regulate pharmacists. We have the General Osteopathic Council. They regulate osteo. So these are all you can read in your model. These are all regulators that regulate various professions. Then we have the social care regulators. So we have the profession regulators. We have the social care regulator. We have the Social Work England, SWC. They regulate independent regulator for social care workers in England. We also have the Northern Ireland Social Care Council. We have the Scottish Social Services, responsible for registering people who work in social care services. There are the social care wills, the social care workforce wills early. You know, so these are all social care regulators that we need to know as a support worker. Okay, you need to know this. Do you have any question at this stage? Are there any question?
No, sir.
Are you sure?
Yes.
Joel, any question?
No, sir. It's good.
Okay, that's it. Let me proceed. 1 minute. Now, then we have guidance, the National Institute for Health and Care Excellence, NICE. Is an executive and non-departmental public body of the Department of Health and Social Care in England, which publishes guidance in 4 areas. 1, the use of health technologies within the National Health Service and within the NHS England. 2, clinical practice. And then 3, guidance for public sector workers on health promotion and ill-health guidance avoidance. 4, guidance for social care services and users. Then we have to look at how it was started in 1999. It's not really important. So NICE was started in an attempt to end the so-called postcode lottery of health in England and Wales, where treatments were available dependent upon NHS health authority area in which the patients happen to live. But it has since acquired a high reputation internationally as a role model for the development of clinical guidance. Then we have to look into professional bodies. We have the British Medical Association, and they act as the unions for doctors in the United Kingdom. We have the good practice. The most simple explanation of good practice, health and social care, involves staff working in a way that puts the needs of the people they are caring for first, so that they receive dignified and thoughtful attention and have the best experience. Poor practice is the opposite of good practice, we all know. So when we say good practice, Adeyemi, generally within healthcare, what are some of the good practices that you think you can give example of?
Okay. Okay, good practice. It's a way as a social worker or a carer that the good practice is following the guidelines and the procedures laid down on a particular or on safeguarding. Just following the laid down rules and applying them in your day-to-day activities as a social care worker.
Okay, that's not bad. Joel, what's your take? Joel,
Hello?
Joel,
Yeah, sir.
what is the good practice?
Good,
Generally, what's good practice?
good practice means they have teaching the social care worker how to learn, improve, and that's all. To how to make a client happy, and feel them better way, feel them in a better way.
Joel, I didn't hear you. Say it again.
Good practice means in health and social care, working in a way that it puts to need of the people, to take care of them first, and thought attention, and have a best experience possible.
Okay, so I mean, Joel, good practice in generally could be when you say in relation to healthcare. we can say patient's dignity. Okay,
Okay, sir.
Okay.
patient's dignity. These are all good practice. You have to ensure that you have to also protect data protection. Okay,
Okay.
of patients. These are all good practice that we have to practice. You know, confidentiality. You know confidentiality, don't you?
Yeah, I do.
Yes. So these are all good practice that we have to practice. And with bad practice, we all know. Making when you're giving information out to people who are not part of your, it is bad practice. You are breaking confidentiality. You are not doing data protection. You are not wearing gloves. You don't wash your hands. You know, it's not good practice. You have to wash your hands before and after patient. Okay. All
Yeah.
right. Yes. These are all lack of bad practices. You know, and then we have to look at the Health and Social Care Acts 2012. You can read about them. You know what they seek to do. Then the Equality Act 2010. We all know equality is to ensure that you give fair treatment to everybody. Okay. You
Yeah.
have to read about them. Then the Social Care Act 2012. You know, what it does, it requires public sector commissioners, including local authorities, health and social care bodies, to consider economic, social, and environmental well-being in procurement or health services or contracts. You know, so you have to read about them in your model as well. Then we have um we have lastly we have they also create social value as clear connections with efforts to reduce health inequalities through action on the social determinants of health. And then finally, defining social value with reference to the social determinants of health can help reduce local inequalities. So this is what they seek to do. These are things you can read about um, on your slides or um, on your model. So today, what we had a look at was the different specialized areas within health and social care, a range of health and social care professions that we spoke about, and how to assess professions and how professionals are regulated. How professionals are regulated, you know, and some of the professionals we mentioned about were nurses, doctors, and name them, and how the regulators were social care regulators and professional regulators, the MMC, the MMC, the ACPC, all of them are regulators. And references that you can look at: your career options in medicine, NHS England, BMA, National Institute of Health and Social Care Excellence, Health and Social Care Regulators. These are all ones you can. So yes, any question at all? Any questions at all?
Yes, sir.
Please, do you have any question? Hello, guys, can you hear me?
Yes, sir, I can hear you.
Do we have any question? I've just finished the lectures. Do we have any question, please?
No, sir.
Ademi? Ademi? Ademi, can you ask? Do you have any question to ask? Oh, they gone off. They can't hear me. 1 minute. Joe, we'll end it because
Hello?
Mhm.
Hello, sir, are you there?
No, I can hear you now. Joel,
Yeah,
I think we'll end today's lectures.
yeah.
Okay.
Thank you, sir.
All right. Thank you. Thank you.
Take care.
All right. Thank you.
I see you.
You know you have to submit your assignment 2 weeks from now.
Assignment, when do I submit?
2 weeks from now.
Now?
2 weeks. 2 weeks
2
from
weeks.
today. Yes.
Okay, sir. Assignment in which site can I submit?
Come again. If you go on your student model, you'll find your assignments criteria. I just did it with you 1 minute. Let me just do it again.
Okay, sir. Can you pass me the link?
Which link? It's on your model.
Sorry?
Just hold on. Let's go ahead. No, just 1 minute. Let me share with you.
Okay, sir.
Look at your screen. These are your assignments.
Mm-mm.
Okay, it's on
Yes,
your
sir.
model, student model.
Okay, sir.
That's your assignment. Ademi, can you hear me?
Sir, excuse me.
I
Hello?
said this is your assignment. You have it on your student model.
Yeah, sir. But hello.
Yeah.
When do I submit? 2 weeks?
2 weeks from today. Yes. We have,
Okay.
I think we have 2 more lectures, isn't it?
Okay,
So
sir.
when
Okay.
we finish, you have to start doing them.
Okay, sir.
Look at you have this. Ademi, can you hear me?
2 more modules are remaining, yeah?
Hello.
Hello, sir.
Hello.
Hi, sir. Hello.
I can hear you. I can hear you.
Sir, the 2 more modules are remaining, yeah?
Yes, 2 more.
Okay,
Yes.
sir.
So if you look at it, you have task 1, which you can start doing them. Task 2, task 3. Okay.
Yeah.
All right.
Thank you, sir.
You're welcome. You're welcome.
See you.
Bye.
Sir, can I leave?
Yes, you can. You can.
Yes.
Let me see.
What's the one we implement for most of now? 1 for 1 month. Sometimes the one just we can't pick the call.
And then music. Now some you have to tell them to me.
Tommy to any dana.
And then 9.
16 hours. Okay, no, Miss on. Don't send question. Don't send me text because that done. Also, after the
Hello?
Are they hear me?
Yes, sir. Are you hearing me, sir?
Yes, we have ended because I don't know why everybody can hear, but you cannot hear me. I don't know the
Okay,
problem.
I think maybe it's my earpiece. I
It's
have to
from your
change.
side here because the other guy was talking to me. Say from your side.
Okay, I have to change it. Sorry, please. You said that you sent the pre-record to our email, to our WhatsApp group, but I've not been able to see any.
Check your model as well. Check your model as well.
Okay,
Okay.
my model. There is
But if not, after every lecture, we normally send the recordings. Okay.
Okay. Sorry, where can I access my model?
Oh, your
Is it
student
on
model.
the?
You don't have your student model.
Okay, it's in my email, right?
Yes. Okay.
Okay, I'll go
All
through
right. You
it
should have your
in my
student model.
email.
All
Okay,
right.
yeah. Okay, thank you.
Okay.
So we are meeting same time tomorrow. Yeah.
Tomorrow. Yes. Same time tomorrow. I have lectures to tomorrow.
Okay. Thank you.
Bye.
Okay, bye.
Yeah. Hello.